who is unconscious,
Complete bed
or it could be someone who is just very weak, or someone who is short of breath. Which exam did y'all just take?
One.
One, okay. So I just want to make sure I'm getting this. After so many sessions, I'm kind of getting confused, so I apologize for that. All right. So it could be someone who, say, a chronic lung patient that gets short of breath real easy, or a heart patient who has a really weak heart and they get worn out real quick. So for those patients, if it's appropriate, we're going to go ahead and do a complete bed bath, and that means we wash everything for them. Okay? All right. So what do we do if it's a partial bed bath?
Let them do their part first.
We let them do what they can do, what they can reach, and then we do the rest of it for them. Okay? What if they have orders from their doctor that they can get up and take a shower? Do we have any responsibility there?
system. The system. What they mean.
What did you say? Right, assist them in and out of bed. First thing though, what are we gonna assess? Even though the doctor said they can do it,
Fall risk and
make sure they're able to get up and move around and get out of bed by themselves, right? Just like that get up and go test kind of that you do in the Hendrick assessment. Okay, we're gonna do that too. When they go in and take a shower, can they take a shower with an IV?
no.
Actually, they can.
You have to cover
You
it.
cover it with plastic.
Yes.
Has anybody ever had a broken arm or a broken leg? Could you get in the shower?
Yes.
How'd you do it? You put a big
Carefully.
rag
We
over
sure
your leg?
did.
Oh my
And we had to seal
Same
it.
deal. It's okay. So we just have to make sure. There's also, I think it's not good practice, but if a patient wants to, they can take their bath in the sink, and you just set them up for that. The only problem is then they get water on the floor, and that's a fall hazard. So I try to encourage them to stay in the bed. If they can't stand up in the shower, to stay in the bed, and I tell them I'll give them whatever they need and get them going so they can take the bath that way. But you might see that in your textbook. I think it talks about that, letting them take a bath in the bed. The other thing I want to touch on is hair care. Why do we do hair care?
Top of the sebaceous glands for circulation.
Talk louder. Be proud. Trust your
I
gut.
usually do.
And if it's
I know
not
I'm
the-
relaxed today.
If it's not the answer I'm looking for, we'll keep working on it, but that's good.
It was right.
Because she said the main reason we do
It
it
was right.
is to stimulate circulation on the scalp and distribute the oils from the roots down to the ends. And because skin can break down on the back of their head,
Absolutely.
so we need to be inspecting the back of their head and the back of their ears and all that too. But that's why we do hair care. You do not have to offer hair care to your patient when you're doing your checkoff. Or you can do like, I got a comb on here and I say, I offer them hair care. And that's all you have to do. Because your partner will be your patient when you do the bed bath, okay? It's not a real bed bath. We're not using water and soap. It's just pretend. And we only have to do one side of the body to demonstrate it, okay? All right. Okay, so we do hair care. Usually that's the first thing I do. And then I want to let them have oral care. So for this guy, he's too weak to do it, so I'm going to help him with it. And I set him up high. I have all my stuff here. I'm going to put my rail down. As long as I'm standing at the bedside and facing the patient, the rail can be down and the bed can be elevated. If I have to step 2 feet away, then I have to put the rail up, put the bed down, okay?
Okay.
But so long as you're where you can see the patient, you can leave the bed elevated, and so long as you're right next to it, the side rail can go down. But I'll take a towel, and I spread it across here, and then I might put one behind his head depending on how messy I think I'm gonna be, okay? So then, do we wash the face with soap and water?
No.
No, we just use water, right.
I
Because
do.
people's skin gets dry, I'm gonna put on one glove. So y'all see me with a glove on because I'm trying to be a good instructor. And not take. I think somebody put a medium in the largest. Okay, so I'm gonna use warm water that I've got in my tub. And then this is the way you make a mitt. Hold it like this, wrap it around your hand, bring this up, tuck that in, and now you have a mitt. And the advantage of a mitt is that you don't have loose ends that are flopping around that can spread bacteria. And so I'm gonna start with the eyes, right? Why do I start with the eyes? Because that's the most delicate area. I don't wanna bring dirt from another part of the face into the eyes. So I'm gonna start with the eyes, and I always wash inner to outer what? Canthus. Everybody say it. Because the more you say it, the more it
Inner
sticks in
to
your
outer
head.
canthus.
So, inner outer canthus, right. Because I don't want to drag any dirt from the outside of their eye into that lacrimal duct, okay? So I wipe one side like this, then I turn my hand over and wipe the other side like that, okay? Then I rinse out my cloth, and I can do the face like so. And on the, using a different part of the washcloth, if you've read through the checkoff, you can just rotate your hand so that you have a clean part. All right? Okay. So I've washed the face, and I'm gonna blot his face dry. I can use this, sorry. Getting ahead of myself. So I can blot his face dry. Now, the next thing, what would we do next? What would you think about doing at home?
Teeth.
Washing your teeth, all right. So I've got him sitting up like this. What do I need to make sure that he doesn't have a problem with?
Aspiration.
Make sure he can swallow okay. So this patient doesn't have any problem with dysphagia. He can swallow okay. So then what I'm gonna do is, he happens to have dentures. So when I get dentures, I'm gonna ask him to, it depends on the patient. I have a lower bridge and I have to pry it up because it fits around my teeth that are still there. There are different ways, so you have to find out from your patient. But usually the best thing to do is take the upper denture out first and then the lower one. So I'll take a washcloth and I'll help remove that lower denture, and I hold it in the washcloth because they're gonna be slippery with saliva. And if I have to go very far, I'm gonna put it in a denture cup that has his name on it. All right, they're very expensive. If they're not in the patient's mouth, they should be in a cup that has their name on it to make sure, play music, to make sure they don't get lost, because then the hospital has to pay for it, and they don't like to spend money on that. They have better things to spend it on. When you're doing your checkoff, you can say that this is your sink right here. So I've carried it to my sink, but before I wash it, I'm gonna line the inside of it with a cloth, so in case I drop it, they don't break. And then I'm gonna clean them under warm water, and you can use a toothbrush, gently brush it. You don't have to scrub real hard like you do on your teeth, because dentures aren't as hard as your teeth are. You can brush it with toothpaste and a toothbrush, and I'm tripping over my tongue, or you can put it with the Efferdent in warm water, so long as it's not hotter than coffee, okay? That's a safe temperature. All right, so then I wash it real good. I put them back in the cup. I come back in here to my patient, and I take it out of the, oh, what should I do before that? Have I finished?
Oral care on the patient.
I forgot, I need to do oral care in his mouth. This is called a toothette. It's just a little sponge. Sometimes they're impregnated with toothpaste. It depends on the brand, but you dip it in water, and then you can use that to clean their gums. And you want to be observing. Yes, ma'am.
Could you use the suction ones on them when you're brushing their teeth?
Yes, if we had them.
Okay.
I just learned about those. I'll tell you what she's talking about in a second. But you just kind of put a little water on it, and you can put a little mouthwash in the water too, and use that to clean their mouth. Little trick that we used to use when we had a patient that was really dirty or really stinky, we would put a little mouthwash in the bath water, and it helped with the odor.
Shaving cream does too.
Shaving cream? I didn't know about that. Yes, ma'am.
So like in real life, if you had to go to a sink, you would just raise the arm, the side
Yes.
rail,
And then go to
come
the
back,
sink, yes.
Put it back down, okay.
Thanks for clarifying that, okay. And then I might put a little bit in here, and I'm gonna use the emesis basin, that's what this is called.
Right.
Kidney basin, some people call it, just for him to spit in. I'm gonna give him a little sip. Try to keep it to 5 milliliters or a little bit more than that, but not much, and let him spit it out when he rinses. Now, if he was unconscious, could I give him oral care like this?
No.
No.
I would need to put him flat and put him in the Sims position. And I'll show y'all how to do that a little bit later on. And also, he's in the Sims position with his head turned, and you want to tuck his chin toward his chest too. Because that makes an acute angle there. So it's even less likely for fluid to go down their throat. Because they can aspirate if you don't do that. Okay. And what she was talking about, this is called a tonsil tip suction. You hook it up to suction, so it's like in the dentist office. And I can suction the fluid out as I'm going. When I have someone that's in Sims position, I can put this down in the bottom of on the bedside of his mouth, and then I squirt a little water in and suction it out as it comes out. Does that make sense to everybody? But what she was saying, now they have one with a toothbrush on it.
Yeah.
So you can brush your teeth and it's suctioning it out at the same time. Ain't
And it's great.
technology grand?
And it's
I would give anything for those, yeah.